Okay, I'm an independent contractor. I sell real estate for a living. And of course, right about now, I'm not selling much, because, to be honest with you. 3 years ago, I was diagnosed with breast cancer. The day that I found out that I was diagnosed was the day of my daughter's second thyroid operation. She was 12 at the time. 2 weeks later, her biopsy came back, and it turned out that she had thyroid cancer. Luckily, it was being removed with that operation, and the treatment was stopping right there for now because of her age. My chemo treatment was going to be August 30th, and when I showed up for my first chemo treatment, the hospital told me that that was not covered. Outpatient chemo and radiation was not covered underneath my insurance plan. If I wanted to have chemo treatment that day, I needed to write a check for $5,200 for the pharmacy, for the meds, just to be able to have chemo that day. Well, it turns out that $5,000 of that $5,200 was for one shot, just so that I could have chemo every 2 weeks instead of every 3 weeks. Needless to say, I went to the shot and said, no, thank you. But I wrote the check for the rest of the meds and continued to do so. Then it turned out with my daughter and everything that also on our insurance, our office visits, we pay for our own office visits. Well, a regular doctor's office visit isn't bad to pay for, but when you start having to go to all the specialists, and every time you go to see one, it's more and more, and they send you to one or two more, those costs keep adding up. Eventually, I was trying to make arrangements to pay for my daughter's bills, and I was speaking to the accounts receivable at one of the hospitals, and they told me I should enroll for Medicare. And I thought, I own a home. How could I even possibly qualify for Medicare? And she said, well, that's what Medicare was originally designed for, was to help those people with insurance as a backup for when insurance didn't cover those things.
Medicare,
Medicaid? Medicaid, sorry. I'm sorry, yes. So Medicaid, of course, I went and I found out about it and got an application and was promptly denied. Well, I appealed, and after months and months and months of appealing, they finally agreed that they would do it as what they call a spend down. As a realtor, there will be some months where I make no money and some months where I make a lot of money. All depends on when the house is closed. If the house is closed that month, Medicaid didn't supplement anything. Months that things didn't, they would help supplement.
Medicaid help?
Medicaid is still helping. There is a backup. The insurance company, we have $3,000 deductibles, $3,000 deductibles for each. And you have to exhaust those. They're not per incidence. It's just when it all comes up, and then it will kick in. They'll start paying. But if the plan that you have here that would help a lot in the instances me, because I have been paying for my own health insurance for years. It's not that I'm not uninsured. It's just that I'm at the mercy of this insurance company, and I can no longer switch.
That's what I was going to ask you. You don't have choices when it comes to health insurance?
No choices whatsoever, and I definitely can't switch now because of the pre-existing conditions. We went through the savings, trying to pay everything off before I found out that I could apply for Medicaid supplement, and that's when I was trying to make payment plans with the hospital because we'd already exhausted the savings, paying everything off to try. So then I was like, well, I got to do something. I have to take care of this. And that's when the hospital told me about it.
Have you ever felt you were in a position where you couldn't afford
Yes.
what was needed for you or your daughter?
Mm-hmm. Oh, yeah. A lot of the times you're thinking, oh, how, is it sick enough? Do you have to go to the doctor? What's really wrong? Not so much for my daughter, but more for myself. Do I need to go? Of course, the kids, they have to go. That's just all there is to it, but,
It's tough.
yeah.
Mine's kind of twofold. First of all, I'm a realtor as well, and interestingly enough, I worked in healthcare management for 15 years before I became a realtor. So I understood the business aspects of healthcare, but I didn't really realize, because at the time I worked for a corporation that provided my healthcare similar to yours, until becoming an independent contractor as a realtor. When Julie and I were married, we decided to have children. For many years, we were unsuccessful, and we needed fertility treatments. And at that point in time, I was working independently, had purchased my health insurance for me and her, and the health insurance plan didn't cover fertility treatments. It was considered an elective. So the importance of having children was so important to us. I liquidated my retirement to pay for the fertility treatments, which gave me a beautiful daughter. Her name's Emma. She's now 5. And then after that, after we were able to get the corrective surgery for my wife that was causing the problems, then Nicholas came along. And Nicholas, unfortunately, has what's called osteogenesis imperfecta, which is a very rare bone disorder. It's called brittle bone disease. That's a common terminology for it. There's no cure or medicines for it. He just turned 3 in April, and he's in a body cast now as we speak, as a matter of fact. He's had his 10th break. He broke his femur. It's his second femur break, actually, as a 3-year-old. And if you can imagine a 3-year-old in a body cast to begin with. But the struggles were obviously the fact that it was such a rare situation, learning about that, but also learning of the aspects of getting notices from your insurance company that it's not a recognized diagnosis, or they don't
recognize.
That was one of the very first things that I heard, which shocked me. How something could be termed as not a recognized diagnosis when there's specialists all over the country researching this very thing. What I learned, and some of it come from my experience in healthcare, was that it felt like to me that a lot of these things were fronts for the insurance companies just to try to avoid having to pay the bills. Obviously, I knew that when the going gets tough, you roll up your sleeves and you do what you need to do to get it done. So we would fight the process. We would, file a grievance, call, have the doctors write letters, do the various different things that we needed to do, which helped. But there's also lots of little ancillary things for Nicholas that we need that the insurance doesn't cover. And, it's sad because I spend days thinking, when I know I have things that I need to purchase for Nicholas, and I interpret them into number of houses I have to sell, even though I have insurance. And not to mention the fact we can't ever change insurance companies now, both for Julie and Nicholas. Julie has a pre-existing because of her surgeries for having children, and obviously with Nicholas. And the scary thing for me for Nicholas is, because I know I'll take care of Nick, is when he gets of age, he's uninsurable because he'll no longer be covered on my policy, but he won't be able to get his own policy the way things are right now. And that scares me to death because this is something that he's going to have for the rest of his life. They say, the specialists tell us that, he can have anywhere between 80 to 100 breaks in a lifetime. And they can be serious. And that's just on a good day. That's, God forbid he ever get in a car accident or something, because his bones are fragile. And it petrifies me. Because there's going to be a point in time when I won't be able to provide for him. So, this really hits home for me. It's a mission for me to work on this at this point in time for his future. So that's really my focus on the healthcare concerns.